Welcome to Forum 360. I'm Ardith Keck, your host today, and we're talking about an organization and a condition. The organization Child Guidance and Family Solutions helps in many ways. One of them is dealing with ADHD problems, and we'll talk more about that. So today, we'll talk about what the organization does, and we'll concentrate on the kinds of problems associated with ADHD and how to deal with it. Many families have to learn more about helping their children and their families cope with it. What kind of problem is it? To help us understand all of this is Don Carter, Director of Children's Services, and Dr. Stephen Jewell, Vice President and Medical Director of Child Guidance and Family Solutions. Our thanks to both of you for coming. I know everybody out there wants to know what ADHD stands for, Dr. Jewell.
Yeah, ADHD stands for Attention Deficit Hyperactivity Disorder. Sometimes people will refer to it as ADD or Attention Deficit Disorder, and they assume if the H is in there, that means their child is hyperactive, and if the H isn't in there, that means their child's not hyperactive. But in fact, ADHD, Attention Deficit Hyperactivity Disorder, is the official diagnosis regardless of which symptoms are evident.
Well, since we're talking about ADHD, besides its name, what is it?
ADHD is the most common mental illness of children. It occurs in approximately 10% of children, and it's characterized by three sets of symptoms. The A, attention deficit, part of it is difficulty with paying attention. The H, hyperactivity, is exactly what it says, hyperactivity. And then also along with that comes impulsivity, difficulty controlling oneself. The symptoms however, are quite specific, and sometimes people misunderstand them. The problem isn't that a child with ADHD can't pay attention, or can't sit still, or can't control themselves. The problem is only that they have more trouble doing those things than the average kid the same age. Mm-hmm. So there are periods of time where they can control themselves fine and pay attention fine, and sit still fine, typically if they're doing something that is interesting to them.
Much more fun.
Yes, so you put them in front of a screen and have them play a video game, they usually can pay attention just fine. Put them in front of a homework, math homework, and you'll see the problems.
Is age a factor?
Well, the typical onset of ADHD is around the age of 8 or 9, but kids with more severe symptoms will manifest the symptoms earlier in their life, and I've seen kids as young as 3 or 4 beginning to show those symptoms, and I've had mothers tell me that their child was hyperactive in the womb. You know, they could tell that they were overly active compared to other children they had carried.
And they said, uh-oh.
Yeah, right, exactly. Yes.
Is there a stigma attached to this?
Well, you know, there is a stigma attached to any mental illness. Unfortunately, I wish it wasn't the case, but it is. And there's a certain degree of stigma attached specifically to ADHD, in that there are some people who claim that it's not a real diagnosis, which is ironic because it is the most researched mental illness of children that we have. I mean, there's been decades of research on ADHD to prove that it is indeed a very real diagnosis, and that the symptoms can be very disruptive to a child's functioning, and that treatments can be very effective in reversing those difficulties.
Can it be cured?
No, it can't be cured. It can be treated, and the symptoms can be ameliorated, but it can't be cured. Interestingly, though, of the children who are diagnosed with ADHD in earlier childhood, by the time they reach their late teens or early 20s, about 50% outgrow the symptoms. The symptoms simply go away by their early 20s. We can't really differentiate kids who are going to outgrow the symptoms from kids who are not going to, based on their presentation earlier on, but that's one of the messages I will give parents, is there's a 50-50 chance that by the time your child reaches their early 20s, the symptoms will simply be gone.
How good. Okay. I was going to ask if it's a lifetime problem, but...
Well, for the other 50%, it is a lifetime problem. Typically, the hyperactivity and impulsivity moderates to some extent, you know, by the time you reach late teens or early 20s, and the inattentiveness remains the problem. Earlier in my career, I became an expert in adult ADHD. Initially, we thought that was a diagnosis that wasn't possible, but probably the youngest child I've ever diagnosed with ADHD was 3, and the oldest adult I've ever diagnosed with ADHD was in his 50s.
They didn't know beforehand.
Right, exactly. The term ADD, attention deficit disorder, was not coined until around 1980. The DSM-3, the Diagnostic and Statistical Manual of Mental Disorders, Volume 3, is the first time that term was coined. Up until then, we thought the disorder was typically or solely manifest by hyperactivity. And it wasn't until then that we realized the inattentiveness and impulsivity were part of the picture as well. So it's really only these last, closing in on 40 years that we've had that diagnosis in our lexicon and been able to diagnose it. I remember the 50-year-old gentleman very well. This was back 20, 30 years ago that I made the diagnosis, and he read an article actually his wife read an article in the Wall Street Journal about adult ADHD, and he said she brought the article to him and said, "This is you."
This fits you.
So.
Well, Don, you've been very patient, and I really want to talk about Child Guidance and Family Solutions. Can you tell me about the organization?
Sure, I would love to. Child Guidance and Family Solutions has been around since the 1930s. It was started by the Junior League as a result of concerns about children and how they were managing their feelings and behaviors during the Depression. We've grown immensely since that time, and Child Guidance and Family Solutions now employs over 180 people to work with children and their families and adults. And we also are in 5 locations, as well as in pediatric practices, schools, and preschools and Head Starts in Summit County.
Okay, you mentioned that you do deal with adults, and that's the Family Solutions part, I assume. How do you contact Child Guidance and Family Solutions?
It is very, very simple. All you need to do is call us at 330-762-0591, and you can ask for admissions or intake, and you'll be put in touch with a live person to talk to regarding whatever concerns that you have and how we might be helpful to you.
And online? If you're online?
Absolutely. We have a website at cgfs.org, and it has loads of information about all the different services that we provide, as well as a way to get in contact with us.
You said 5 different locations.
Absolutely.
Are they in metropolitan areas? Are they Akron? And
well, if we start in the north, we're in Twinsburg, and if we move south, we're in Cuyahoga Falls, and then our central office is located right on the edge of downtown off of Route 8. Our eastern location is in the Ellett region of Summit County, and then our western in Barberton. But we are in multiple school systems, and also therapists who are actually in the schools to work with the schools, as well as, I'm thinking, is it about 10 or 12 Akron Children's Pediatric practices, as well as all 14 Head Starts in Summit County.
okay, one of my questions was, do you work with the schools? So obviously you do.
Yes, we do.
You have locations in the schools?
We do. We have 2 kinds of ways that we work with schools. We work with schools where some schools actually employ one of our staff, and they may do a variety of things that the school might need. Everything from educating teachers and working with children who are on an IEP, to doing crisis work, to
IEP.
Individualized education program for that child who might have special needs, to working on a suicide prevention or a multicultural group. Multiple things that we do. We also have staff who are designated to go into certain schools where they are actually treating the mental health disorder that the child has, and working with the teachers and the school counselors to make sure that those symptoms, such as ADHD, are not interfering in their success in the school.
And I would imagine sometimes a child is diagnosed via a school program.
Yeah, absolutely. In order to make the diagnosis of ADHD, it really requires seeing the symptoms in more than one setting. As I like to say to parents, there's no such thing as home ADHD. If your child truly has a biologically based disorder that interferes with their functioning, you should be able to see it both at home and in the schools. So in order to make the diagnosis, we have to confirm the presence of those symptoms in both of those settings. So teacher input is critically important. And as you can imagine, since we're talking about a disorder in which the kids have more trouble paying attention than the average kid their age, being able to compare them to their other classmates is really important, and that's something really only a teacher can do. If you've got a classroom full of third graders who are all very active and all somewhat impulsive and all inattentive at times, it really takes the teacher's input to pick out that one child or two or three who have much more trouble with those problems than the rest of the class.
Right, right. Now, does Child Guidance and Family Solutions charge people for their help?
We do accept commercial insurance, which will pay for services, as well as Medicaid. We also, because we are in Summit County and have the Alcohol, Drug, Mental Health Board levy, have a sliding fee scale based on income. So we're not going to turn people away if they're in need of services. We also have some prevention funding through our Alcohol, Drug, Mental Health Board as well, because if we can do things, particularly for our preschoolers, to help prevent the onset of a mental illness, we want to do that as well.
If a child needs psychiatric treatment, what happens?
Well, Dawn mentioned how people can call in and tell our intake staff what the issue is, what their concerns are, and typically after that conversation, an appointment is set up for an initial intake, and so they'll meet with one of our master's level psychologists or social workers or counselors for that initial intake. All the important information will be gathered, and then based on that, an initial diagnosis is made and an initial treatment plan. And that treatment plan may include psychiatric services as part of the overall treatment plan, or it may not.
Does Child Guidance offer psychiatric treatment?
Yes, as the medical director, I oversee our medical staff, which consists of 3 child psychiatrists and 4 nurse practitioners. And so if the initial intake indicates the need for psychiatric services, then that initial, the person who does the initial intake will refer to one of my staff for a psychiatric evaluation and ongoing treatment based on that. So.
We're talking about Forum 360 today. We're talking about Child Guidance and Family Solutions, and also ADHD, which we've defined, and hopefully everybody understands the problem a little bit. With me is Don Carter, Director of Clinical Services, and Dr. Stephen Jewell, who is Vice President and Medical Director of Child Guidance and Family Solutions. And do you go out into homes at all? Is that a part of the program?
It is. We do have intensive services and community-based services. Now, our role is different than, say, from Summit County Children's Services Board, who investigates child abuse and neglect. We don't do that. That's a separate organization. Our role when we go into the home is we've identified that there is a mental illness in the child, and we're working with the child in their natural environment and their family in their natural environment. So, for example, when a child has ADHD, part of good treatment is helping the parents structure that time for the child. So we may have a master's level therapist or a bachelor's level case manager who will go to the home, work with the parents on helping structure that time, picking and identifying that one behavior that they're going to work on, because we know that you can't work on 15 behaviors at once and see change. We might also have them go to the school and meet with the school. And if, as Dr. Jewell said, it's extremely severe, and we do work with children who have very severe mental health problems, we can wrap our intensive home-based program around them, where it's 3 to 5 hours a week working with them in the home, in the community, the school, and we do that for a short period of time, 3 to 6 months, so that we can get that crisis stabilized and prevent them from either going to the hospital or a residential treatment facility.
Wow, I'm impressed.
Good.
Has child guidance been affected by the opioid crisis that we have in Summit County and around the world, I guess, but substance abuse problems?
Yeah, to a degree. I mean, the opioid crisis is really more a problem with the adults and older adolescents. So while we do see some clients with that, and we do provide some drug and alcohol services, you know, we're not dealing with the real severity of the problem that the adult drug and alcohol agencies are dealing with. Mm-hmm. But certainly, it's had an impact, and it's had an mm-hmm. indirect impact on a number of our kids as their parents mm-hmm. have been touched by
Yes, I would
this.
imagine
Yeah.
the parents might
Yeah. In fact, there's some research going on right now out of the University of Cincinnati that suggests mm-hmm. that the increase in the suicide rate in the state of Ohio over the course of the last couple of years in children may well be due to the trauma caused by the opioid epidemic impacting their parents.
Mm-hmm. So. Wow. And actually, I do want to talk about suicide because this is one of the problems mm-hmm. with kids. I understand that 9.7% of Summit County students in middle school have considered suicide. Mm-hmm. That's scary.
Yeah.
Yes, it is. It is frightening. The ADM board did the survey that came up with that number, and it was surprising to all of us that you know, that so many middle school and high school students had seriously considered suicide. I was just doing a presentation the other day on with our trainees in child psychiatry, talking about suicide in school-age children and then younger children, and the rate of suicide, of completed suicide, according to the national statistics, for people who are in middle school and high school age is about 5 per 100,000 population. The rate of suicide for people younger than that, under the age of 10, is much less. It's about 0.1 per 100,000 population. But I think it's important to note that it's not zero. There are still very young children who commit suicide. And so it's an important public health issue that we need to pay a lot of attention to. And suicide prevention, Dawn mm-hmm. was talking about prevention earlier, suicide prevention is a crucially important aspect of what we do, trying to identify kids who are at risk and do what we can to prevent them from ever getting to that point.
Mm-hmm. So. If you can figure that out. Now, people come to you, they call the agency or deal with it online or whatever. Are they ashamed to contact you at times? Do you find that people don't do it because they're...
Well, yeah, and you were talking about stigma earlier with regard to ADHD, and there's no doubt that there is stigma associated with having mental illness. And it's unfortunate, and as I said before, I wish it didn't happen. But that's a big part of why we're out in the community. It's an important part of our strategy for reaching out to kids who are in the community who might need these services but wouldn't necessarily feel comfortable coming in. So if we can go out to them instead of them having to come in to mm-hmm. us. I mean, the statistics say that of adolescents, 20% have a mental illness severe enough to impair their functioning. But of that 20%, only 20% of them ever get diagnosed during adolescence. The other 80% go on into adulthood before they're ever diagnosed, if they ever are. Mm-hmm. And it's really stigma that predominantly prevents them from doing that. So when we go into pediatricians' offices, that's the primary reason that we're there. We know there's 80% of those kids who are not being identified, not being diagnosed. And if we can be in the pediatrician's office and help the pediatrician to identify those kids and get them into services through the pediatrician's office, which is a more normalizing environment. You know, parents don't have any problem bringing their kid to the pediatrician, mm-hmm. but they might have a problem coming in our front door. You know, if we can be there where they feel more comfortable, we can provide them services right in that setting. So.
We just started a new website, just kicked off specifically designed for adolescents called We Hear You, and it's a great resource to get out for adolescents to be aware of, because it talks about many of the different things that they experience: anger, frustration, identity issues, family problems, and it's a great resource and tool since kids are on their phones and online a lot. And so, you know, we want to promote that as a resource for adolescents in particular to reach out for help, because they'll probably be more likely to go online than they are to walk into their you know, guidance counselor's office and say, hey, I think I have a problem.
Yeah, the stigma issue is a big concern, and one that probably doesn't need to be a concern. If you think about it, if you asked a parent, you know, what do you think is the likelihood that your child between birth and 18 will get physically ill, they'll look at you kind of funny and say, well, 100%. I mean, every kid gets sick, right? And the truth of the matter is that the same thing applies to mental illness. You know, with physical illness, you know your child's going to get sick at various points during their childhood, and the only concern is how severe that illness is and how life-threatening it is. And the same thing is true with mental illness. During the course of a typical childhood, kids experience symptoms of mental illness, periods of anxiety, periods of depression, periods of disruptive behavior. That's just a normal part of it, and it's the only question is how severe is it and how much does it interfere with functioning. And so that's our effort, is to really get out there, help people understand that mental illness is a normal part of growing up, and to identify those kids with more severe needs so that we can intervene as early as possible and prevent long-term disability as adults.
Yes. And when parents are struggling with what to do about kids with ADHD or any other problem, how do you advise them?
Well, every child is unique, and so it really depends on the individual child what to do. But I mean, the bottom line is, if you happen to give birth to a child who winds up being diagnosed with ADHD, it's sort of similar to if you happen to give birth to a child who winds up being diagnosed with diabetes. You know, you may not know much about diabetes. The average parent doesn't know much about diabetes, but as soon as you get the diagnosis, you want to know everything you can. And you learn everything you can so you can manage their insulin and you can help their diet and do everything that's necessary. And the same thing applies with ADHD. If your child is born, happens to have ADHD, you want to learn everything you possibly can about how to help the child manage their behavior and function at their optimal level throughout their childhood. And as I said, every child is unique, and so the specifics of what they need to learn vary from child to child to child, but the concept is the same. You want to learn as much as you can so you can help your child through the difficulties.
And there's lots of help for parents with child guidance.
I'm glad you asked that, because we have several different kinds of parenting groups. For our younger children, we have an evidence-based practice called Incredible Years. The younger children get to go to dinosaur school, where we have life-size puppets of a 4-year-old, and they get to meet Molly, Wally, and Dino, and they begin to learn skills in terms of self-regulation, emotion regulation, social skills. And while the children are in dinosaur school, the parents are also going to learn about how to work on that relationship, because many times when you have a child who has ADHD, that relationship is taxed, and those parents can be tired and frustrated. And so we want to work on that, as well as helping them know how to shape and mold their child's behavior for success. After that, we have a wonderful evidence-informed practice called Parenting Wisely, and it is also for that preteen to teenage years, and that is also a time for working on building that relationship and helping those parents know how to manage those more disruptive or oppositional behaviors that can happen. And we're very fortunate we have that not only in English, but we also have that in Spanish as well. So we have an entirely Spanish-speaking parenting group as well. And then specific to our children with ADHD, we actually have an ADHD parenting group that talks about many of the things that Dr. Jewell has already shared with you. In fact, he actually comes in to talk with the parents about medication, but it talks about education and how to help parents understand their child's illness and how to help that child cope and the family to do better.
And probably it helps the parents to be able to talk with other parents about
Exactly.
the problems.
Absolutely.
And what did you do and what can you do and
Right.
so forth.
And we're not the only ones.
Yes,
Yeah.
exactly, exactly. Well, I have a couple of quotes that came, I think, from you. I'm not sure. There is no health without mental health, and this is certainly true. And investing in our children is an investment in the well-being of the entire community. We need to watch and be careful and certainly help if we can. I really appreciate your coming today, Dr. Jewell and Dawn Carter.
Thank you.
This is an interesting show, and I think we've all learned a lot about not only ADHD, but child guidance and family solutions.
Okay.
This is Ardith Keck for Forum 360, and it's a local, global outlook with a local view. Thank you.
Forum 360 is brought to you with support from Electric Impulse Communications, Kim and Harvey Nelson, Rubber City Radio Group, Acronist.com, Hudson Cable, Medical Mutual of Ohio, Forum 360 supporters, and the Shaw Jewish Community Center of Akron.